If you don't replace a missing tooth and you leave an edentulous space or a space where a tooth used to be in your mouth, the opposing tooth will either move upward or downward, depending on wherever the location of that tooth is. And that can start to cause a lot of issues with your bite. That can start to give you joint pain. A single tooth implant is when we have a site in someone's mouth where the tooth no longer exists. If at the time that tooth was removed, if there was a bone graft that was done, then that site is ready to have an implant in as little as 3 or 4 months after the bone graft and the extraction took place. A single tooth implant is the placement of a titanium fixture within the bone. We do guided implant placement. And so we plan an implant with a 3-dimensional x-ray and a intraoral scan. Once we take that information from the patient, we send that to a company that will allow for me and the representative from the company to virtually place the implant. So we virtually place that using that information, the 3-dimensional x-ray and the intraoral scan. Once that implant is placed virtually in exactly the place that we want it, then that company will make what's called a surgical guide. It makes for an experience that's much less invasive for the patient, and because of that, it makes for an experience that is far more comfortable and require far less healing time. We have people that leave after we place a guided implant in our office. They go to work right away. They don't have to miss work. Most of the time people say, I didn't have any discomfort. We recommend ibuprofen after an implant placement. It's very, very simple.